Hi there, my name is Moyen, I'm from Urban Leopard, and welcome to this week's Exercise in Focus. This week, our exercise focus is the deadlift. So we're using a kettlebell for this one, and this is an exercise that we use all the time in clinic. We prescribe it with our clients who are suffering from low back pain or just some general weakness through the posterior chain, which is all the muscles through the back half of the body. And we put it into our classes as well quite regularly. Okay, so the setup. First of all, I've got my kettlebell here. I'm going to line this handle up with between the arches of my feet. From here, I'm going to soft bend in through my knees, and then I'm going to hinge my hips back towards the wall behind me. So I'm wanting a nice stretching through my hamstrings when I come into this, and ideally a vertical shin. So hinging through the hips, having that idea that you're directing your glutes to the wall behind you, nice vertical shin, overhand grip, so knuckles over. Then before I lift, I'm going to draw my shoulders in to my midline, look up straight ahead, take a deep breath, and stand tall. From here, again, soft bending through the knees, hinge the hips back to the wall behind me, and slowly lower the kettlebell back down into where I picked it up from. So that's our one rep. One more time. Slowly lowering down, good control, and place it down gently. Common mistakes we'll often see is when people come a little bit too low into a bit of a flexed knee, so it becomes a bit more of a squat, or they may have a scooped out lumbar back, which obviously puts all the weight through the lower back and can cause injury, or they're a little bit flexed through the upper back, and again, that's where all the loading goes through there. So just wanting to keep that nice neutral spine. A good way is just to put one hand on your chest and one hand on your belly and move it all as one unit as you come down. But give that a go. That's our exercise in focus for this week. I hope you enjoyed it. Take your time in the setup with the cues, exercise safely, and that will get you nice and strong and safeguard you from future injury. Reach out if you have any questions. We'd love to answer them. Take care, and we'll see you next week. See ya.